Hi, I'm Steven Santilli, Assistant Superintendent at the Egg Harbor Township School District, and we are back with another edition of Every Hand Together, Pursuing Public Health. Today, our focus and our topic is going to be on nutrition, family health, wellness, and our guest is Dr. Dave Sarnoff, who is a chiropractor. So welcome, Dave.
Thank you. Glad to be here.
So we're going to start off and we're going to dive right in. And our first question is about how would you explain the value of chiropractic care to somebody that would be a new patient?
You know, my favorite patients are people that have never been under chiropractic care before. Then I get a chance to, be the first impression for them. And it's pretty simple. You know, it's power on or power off, and that's what the bracelets that we wear and we give to our patients. There's when God made the body, He put one organ that's in control of the entire body, protected inside of our skull, and it's the brain. And the brain communicates to the heart, to the lung, to the kidneys, to the stomach by this life hose called a spinal cord. And then there's smaller life hoses called spinal nerves that come off the spinal cord that go to the heart, liver, and lungs. And think about the spinal cord as like a garden hose. And with the garden hose transfers and it goes to the tomatoes. If you kink the garden hose, what'll happen to the tomatoes?
They're going to die.
Right, they're not going to grow right. And if it's just a slight kink, it could suffocate the tomatoes. And then if the medical profession comes in, so to speak, and puts quick grow or fertilizer on the tomatoes, you'd have an adverse reaction. So the truth be told is if you just unkink the hose, you don't even have to watch the tomatoes. They'll grow, you take them, you eat them, turn into life. Mm-hmm. So in chiropractic, what protects that life hose is 24 movable bones called vertebrae. And then those bones have a plethora of muscles, ligaments, and tendons inside of it, around it, and in between it. And when those bones misalign, so to speak, it puts tension on the life hose, and the signals from the brain aren't getting to the heart at 100%, which could cause the heart to act erratic. Maybe it beats too fast or it beats too slow, high blood pressure, low blood pressure. If it's going to the stomach or the digestive system, it could have hyperactivity or hypoactivity. Hyperactivity would be diarrhea. Hypoactivity would be constipation. Okay. So what we tell our patients is if you have a symptom and your body's acting erratic, before you put medicine into your system or before you get surgery, see if there's a natural response. See if there is a misalignment in one of the vertebrae that's putting tension on. A lot of times when people say, they'll say, I have mid-back pain. I'll ask them, I'm like, do you have any breathing problems? Do you have any anxiety? Mm-hmm. Do you have any worrisomeness and stuff like that? If they have low back pain, I'll ask them, do you have any digestive problems? Do you have an irregular menstrual cycle? If they have neck pain, I'll ask them, are you having trouble with concentration, sleeping, headaches, and different things like that? There's three ways that the body can misalign, or three stresses. One is obviously something that you and I didn't grow up with, but it's a physical stress. Kids nowadays are just looking down.
Okay.
We never did that growing up. Yeah. So they call that text neck or digital dementia, and kids are just nonstop like this, which puts a tension on the upper brainstem. And what will happen is over time, not only will that cause a non-attractive posture, not only will it cause muscle spasms and stuff like that, but it'll interfere with the signals going from the brain to the body. So one of the easiest things I do when people come into my office, I say, stand like this and bring the cell phone to you. Another physical stress could be a car accident, recreational sports, or sleeping on the couch the wrong way, carrying a book bag only on one side versus on both sides. And the other two stresses are chemical stress and emotional stress. Emotional stress could be maybe we're not getting our way, or we have a big project, or the board meetings and different things building up. Emotional stress could be having a sick relative and have to take them to the hospital, or maybe they pass away and, dealing with the grievance and stuff like that. Yeah. And the last stress is chemical. Chemical stress could be, fast foods like McDonald's. Mm-hmm. Chemical stress could also be eating too much carbohydrates or sugars, or wanting to lose 5 or 6 pounds for the summertime and depleting yourself of carbohydrates and sugars. So just to recap, there's 3 stresses in the body that cause the muscles to shift and the bones to get misaligned. Physical stress, emotional stress, and chemical stress.